Good morning, Caroline. How are you today?
I'm good, thank you, Mike.
Um, it's firmly in the summer weather, and
I know it's beautiful this morning.
I know it's always a bit bittersweet though, because it brings the hay fever with it. I love the summer, but yeah, I always suffer
That's what
with the hay fever.
antihistamines are for.
Well, indeed, they do work very, very well, but yeah. So, anyway, I'll crack on because, just for your information, we've had twice the number of questions we'd normally expect in the last fortnight. 32 questions, which is an awful lot.
Okay.
We won't.
I'll try and be snappy in my answers then.
We're certainly not going to get through all of them, but hopefully we can maybe get through half of those today. I think I also noticed this was the 10th podcast or Q&A session that we've done. And I thought it was maybe worth having a quick look back to see just how many questions you'd answered as part of these sessions. And I noticed by the time we get through today, you'll have done 150 questions. And from the survey we did in May, I know I think it was 85% of people said they were keen for you to carry on doing these sessions. And you've kindly agreed to do another one next week, which is really helpful. I just wondered if you wanted to reflect on where we are with the Q&A sessions and some of the visibility work in general.
Yeah, Mike, and I suppose I'll start off just by thanking you for your help with this, because if it wasn't for you encouraging me and doing all the stuff that you do to prepare for it, then we most definitely would not have achieved 10 episodes and 150 questions. So that's great. This approach to increasing my visibility was one of a number of things that I'm trying to do. And the reason that I think that's really important is to make sure that colleagues across health and care know who I am and recognise me as somebody that is approachable and here to do a job like everybody else. And I don't think any of us can do our jobs in isolation. And for me, it's really important to continually make sure I am connected to those that are delivering direct services. And I do that in lots of ways. Um, so I think this has been really useful. It's definitely kept me grounded on the things that really seem to matter. And there's been quite a broad range of questions, which has been useful. But in particular, I've been struck by the number of questions that are just about the 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 things. I'm going to call them really simple things, but they're actually not really simple things. But the things that really matter. And I think most of you, if you're regular watchers of this, will know that a lot of my deferring when I can't answer is to Paul Allen and to Tom Power, who are colleagues in my team. And so I absolutely recognise the additional burden that this is putting onto them and their teams to come back with responses. And June as well, actually, June Brown, our Director of Nursing. So I think that actually being able to get the themes that are coming out of the questions, because there are quite a few kind of common themes that just allow us to think about how we are doing the work we're doing, and are we doing what really matters to people, and not getting carried away with lots of highfalutin strategic things, when actually, if we can't get the foundations right of people getting breaks, people getting fluid, people feeling valued, knowing how we can make their working environment the best possible way it can be, then I think we're not going to get to where we need to get to. So all of this is about working to understand what matters most to colleagues. And I think for those of you that participated in the Culture Matters works, one of the things that absolutely came out of that was the difficulty in dealing with problems at the earliest stage. I think I've mentioned that before, and described it as the problem pipeline. So this is one way, I think, of me just having a sense check of what are the kind of bubbling issues across the organisation, and are we dealing with them or are we not? And just to make sure I keep on top of that with the teams. So I think a couple of things. as part of this year's delivery plan for the plan for the future, and I hope that most colleagues at least recognise that language, even if you don't recognise the detail of what's in it. Colleagues and how we as an executive team are visible, are present, are making sure we're creating the right conditions for people to flourish, then that's going to be something that we will set out in August in our board meeting. And I really would like colleagues across the system to hold me and the executive team and the board indeed to account. So we'll say what we're going to do, and I would like feedback on, are we doing it, and are we doing it well enough? So that's one thing. And then the other thing about these Q&As and the in conversations, Mike, I think we need to keep it fresh. I think that I'll keep doing it as long as I believe people vote with their feet, so to speak. So as long as people are watching it and it's useful, recognise it doesn't meet the needs of all. But if it's getting, I think, what did you say, 2,000?
It's 2,000 on average. I think the most we've had is 4,000, but on average about 2,000 people.
Yeah, so I think that for me is good, and so I think that we'll keep doing that. But if anybody has any ideas, if you've seen things like this being done in other organisations or by other people, and you think, right, Caroline, you need to step it up a bit, this is what you could do now, then I am more than interested in doing what's going to matter most, and actually making it a bit of fun as well for folks. So if people want to join me, if we want to, you might note that Mike's got new software, which I hope is going to make a difference. So if there's other ideas that others have, then let's just give it a go.
Thanks, Caroline. And I think Ollie and Max's periodic appearances on the podcast tend to help make it fun, at least. So,
well, Max is there's a bay window just behind me, or in front of me, and Max is currently sunbathing, so that could go drastically wrong at any point if somebody chooses to walk past the house. So we'll see.
Okay, right. As I said, I'm conscious that there's quite a lot of questions to get through, so I'll crack on with the first one. That comes from a member of the Facilities and Estates team who wanted to be anonymous. He says that he believes long service rewards were stopped some years ago, and at the time the board were going to look at alternative ways to reward long service within NHS Grampian. He asks if there have been any discussions in recent times with reviewing that and putting that back in place.
Yeah. Okay, so I am going to really try to be succinct in my answers. So long service awards were stopped for a period of time, pre me being in this job, and I don't know the rationale for that, and I'm not sure. However, they were restarted pre-COVID actually, and I certainly have. I think there might have been a pause over the past couple of years at some point, but the long service awards virtually are up and running. I know that because I sign the certificates. Some of you might have seen me on Twitter on Monday morning signing 25 years, 35 years and 40-year certificates. And it's either myself that has done the presentations or one of my non-executive board colleagues. And although it's online, it is fun, and those that put their names forward are invited to come along and attend that virtually. Now, what I don't know is when we're going to transition from virtual to in person, and I need to ask that question, but there's no reason why we wouldn't do that. And the other thing, because I've got one of these in my diary in the next couple of weeks, actually, I think it's next week, and that's the one I was signing the certificates for. I noticed on the webpage that the long service awards are only given to those that have been NHS Grampian employees for 25, 35 and 40 years. And whilst I think I understand why we would do that, I actually think we need to be a bit more outward thinking about those that have worked within the NHS for that period of time. So I'm going to speak to Tom about just refreshing some of the processes around it. But it's up and running. You can nominate yourself. There's a web page. And I am doing a morning session next week, I think, on it.
Okay. I'll find out the intranet page for it and put that in the video description as well,
Perfect.
just in case people want to put their colleagues forward, etc. Okay, so the second question is another anonymous question. This person has asked why it takes so long to get posts advertised and processed via job train. She goes on to comment that some departments wait weeks for frontline clinical posts to go up on the site, and they're in the meantime having to maintain services with reduced staffing. She also says these delays in the recruitment process are causing more stress and anxiety for staff, and people are starting to speculate whether this is NHS Grampian trying to save money. Is there anything you'd like to say about that, Caroline?
So I can start off by saying this is absolutely not about NHS Grampian trying to save money, because we don't, because we end up filling those vacant posts with far more costly agency staff if we can get them. And so this is not about us saving money. However, I completely agree. Having tried to get posts through JobTrain, it doesn't feel as if it is a rapid process, although there are human interactions with it that indeed also slow it down. So I think all I'm going to say is, Mike, I recognise that job train causes a huge amount of frustration because it's actually a lot of work for people. However, it is a step forward in trying to digitalise our recruitment process, so it does bring some added benefits. I think we still have significant work to do, however, in making sure that our recruitment processes are slick and focused on getting people into posts, the right people into posts as quickly as possible. I would say a bit of that is about the system, a bit of that is about the people that are inputting the data, and a bit of that is about the resources that the teams have. Our recruitment team in NHS Grampian works really hard, and they're a really small team. So trying to do recruitment across the whole organisation. So it's not one solution. I recognise it's not where it needs to be. Tom Power, who's the director that's accountable for the HR colleagues that work around this, and kind of overarching monitoring of our performance in relation to recruitment, knows that it's not where it needs to be, and it will be a key area of focus over this next year in regards to how we can improve the experience of people using the system, and indeed getting people into post more efficiently. But it's absolutely not about saving money.
Okay, thank you, Caroline. And question number 3 comes from an anonymous member of the admin team. They've asked, why can't annual leave for Christmas and New Year time not be approved until October? Mentions that this causes stress and worry if your holidays will be approved, especially in terms of trying to get childcare arranged. I don't know if you could comment on that, Caroline. I actually checked when I saw this question come in, had a look at the policy, and I couldn't see anything that said specifically that was NHS Grampian's policy, but you might be able to clarify further. I'm not sure.
So I'm glad you've looked at the policy. I am not so familiar with the detail of that. So I think my first comment would be, having worked as a nurse for 25 years clinically, I absolutely recognise the distress and the anxiety that waiting to know what your rota is going to look like over Christmas is an absolute nightmare. However, I also recognise that we're a 24/7 public sector, and and I've also been in the position of having to manage those rotas. It's really, really difficult. So acknowledge that planning for family, be it childcare, be it caring responsibilities, or just be it about how you're going to celebrate the festive period with your friends and family, is really important. I am not I'm not familiar with local standard operating procedures, but would suggest that this colleague has a discussion potentially with the HR hub. I don't know if we've got a link we can just pop in around what the options are, but this is always a balance. I know this is always a balance of trying to do everything that everybody in your team wants and maintaining service delivery. But I wouldn't be able to speak, if it's not our Grampian policy, I wouldn't be able to speak to the kind of local nuances of that. So chat it through. I'm presuming because you're contacting me in this way and anonymously that that you don't feel approaching your line manager is perhaps the best option. So the HR hub can give you some guidance and advice on that. But I understand it's really good to be able to plan as far ahead as possible.
Thanks, Caroline. I know you are always keen to encourage people to take their annual leave within the calendar year. So I just wondered if you wanted to say anything on that topic while we were speaking about annual leave, particularly in the context of the last couple of years.
Yeah, so I just think, I mean, nothing to say to add to that really, other than we continue to have a significant amount of leave that is not taken. Sorry if you can hear that, that's Max's tail bashing against the plant. For me, that is a concern because I absolutely believe that to work at our optimal levels, then we need to be able to take time to rest, recover, and spend time with our family. So, really, really important that leave is planned and planning it as far ahead. And I mean, I know there are some teams that have to put their full year's leave in the March of the earlier year. Now, whilst that is a real challenge, at least it means that everybody's got their leave allocated and there's fairness across the team. So local teams will work out how to do it, but absolutely the key thing is planning to get your leave in is really important.
Okay, the next question is again anonymous. It comes from someone who says they were a vaccinator on a bank contract. They've mentioned over the past few weeks, this question did come in a couple of weeks ago actually, but up until that point, over the past few weeks, they mentioned that they'd had a number of shifts cancelled and there were no shifts available for the foreseeable future. She says she's hearing various accounts as to whether there will be a need for vaccinators from September onwards when the flu vaccination programme starts, and asks if Caroline can shed any light on this.
Yeah, so firstly, huge thanks for your work around vaccinations. It's clearly been a really, really important piece of work and has made a huge difference to the safety of the population. I'm not sure just around bank shifts, etc. around this. And however, what I do know is that the colleagues that were in temporary contracts, those that were successful in securing permanent posts have done so. And this is about vaccinations of the whole. It's not just about COVID and flu vaccines. What we're trying to do in Grampian, like other health boards, is to consider how we effectively deliver all vaccines, so from birth into adult. And I know that we have more vaccinators in our system to increase the capacity for obvious reasons. However, I also know that from September, when the new flu and COVID vaccines are required, then there will be an increasing need to utilise bank colleagues for that kind of surge capacity. So definitely from September onwards, I would imagine that bank colleagues will be utilised.
Okay, thanks, Caroline. Question 7 comes from Moira Geddes, who's a location manager in Aberdeenshire. She mentions in episode 6 of Ask Caroline, there was a question about staff accessing bottled drinking water as the quality of the drinking water on the wards was felt to be poor. She says they feel they've got the same issue in Fraserburgh Hospital, and she wondered if this was something that could be linked in with that and looked into, and whether there had been a solution to the previous question. I think that was, from memory, wards 207, 208. Are you aware of any update on that, Caroline? I think Kate in your team had sent a message to Paul Allen asking if there had been any progress just when she saw this question come in, but I don't know.
So I'm not aware of an update around that specifically. Around Fraserburgh, I am aware from the Q&A. I couldn't have told you it was Q&A 6 about the issues relating to water in wards in the surgical zone in ARI. And I think that was about we provide water during the summer but not during the winter. The water in the surgical wards that were mentioned in Ward 6, I believe that's sorted, and thankful to colleagues for doing that. I'm not aware, Moira, of any issues in Fraserburgh actually around drinking water. That's the first I have heard that. That doesn't mean to say that other colleagues are not absolutely aware of it. So I think from this video, Chantel will reach out to you, Moira, and work out what we need to do around that. Colleagues have to have access to safe and nice drinking water. So just as these things are coming up, Paul and the team are dealing with them.
Okay, the next question comes from a consultant colleague, Bryce Renwick, who says, could he ask Caroline about the NHS Grampian Cycle to Work scheme? Bryce says he feels that the NHSG scheme isn't as generous as some of those available elsewhere in Scotland. He highlights Lothian and Greater Glasgow and Clyde in particular, and he mentions that they're more generous in terms of the number of retailers you can choose from and in terms of the total savings offered. And he's asked if NHS Grampian would be willing to look into this.
Yeah, Bryce, thanks for the question. I'm delighted that the Cycle to Work scheme remains really relevant, particularly in light of the questions I receive about parking, where we need to get to in regards to our climate sustainability and, of course, health and well-being of colleagues, not to mention the cost of fuel. So really important. I have no idea why we would have a different position to Lothian and Glasgow in regards to the allowance that is, or the amount of money that is available, or indeed the number of companies that you can go to purchase that. So we need to I need to look into that. I do know actually that we did improve it because there was something a couple of years ago where I think it was just a cap of £1,000 or something, and I know that has now been increased. But clearly, Bryce has looked at it, and it's not comparable to Glasgow and Edinburgh. So let's look at it, and if there's a reasonable explanation or one that's defensible, then I'll come back with that. Otherwise, hopefully we will make sure we've got parity. I can't quite understand. I thought it was a national scheme, so I can't understand why there would be a difference. What would be really helpful, Bryce, just to save time, is if you can come back with the specific difference. That would be really helpful to save me spending time having to do that.
So we've got a question from an anonymous healthcare support worker who's asked whether there will be a pathway for progress for established Band 3s to move up to Band 4, as is happening with the Band 2 roles into Band 3. Is there anything you can say about that, Caroline?
So I can say that there is absolutely a need to expand our healthcare support workers' scope of practice to level 3 and level 4 of practice, which would relate to Agenda for Change pay scale 3 and 4. I think there will be the first stage will be from 2 to 3, and that will be a larger volume than 3 to 4. However, I believe through the workforce planning requirements that, and doing the right thing, again, back to developing all colleagues, then that is work that is underway. The associate practice educators should be cited on the plan around that. And if not, then I'm going to direct this colleague to Jane Ewan again to just set out. And I think there's a few times that's been asked. So I think there is a message for me here that we're needing to just do a bit of communication with the healthcare support worker community in regards to the enthusiasm and opportunity and excitement that this is being met with. But clearly, we've got a bit of a comms gap because I think that I certainly feel as if I'm answering a few questions around that. So if that colleague could go to Jane Ewan specifically, if they've already spoken to their associate practice educator. And then, Mike, I think we should probably pick up just on something going in the daily brief around this is the plan, this is what's happening. It won't be fully formed because the teams around it are working hard to do it to produce what's needed with colleagues. So it'll take a bit longer, but hopefully that'll be a better end product. So I think we need to get a bit of a comms piece in the daily brief for teams.
Yeah. I think, as you say, I think that might be the third or fourth time we've had a similar question to that. So, yeah, I think you're right. Okay, the next question comes from an anonymous Chalmers Hospital member of staff. She asks why there is still 2-metre social distancing in place in the community hospital, particularly in the staff dining area. She asks why that would be the case, and she feels frustrated that it seems like Chalmers isn't keeping pace with other sites. Would you have any advice about that?
Yeah, so I'm not sure. My understanding was across all community hospitals, all social distancing had been removed, other than exceptional circumstances that had been agreed through risk assessment with, for example, the senior charge nurse, the infection control team, and I suppose the other group that would be around that would be those colleagues that are working in the safer workplaces group. So I don't know. I understand. Gosh, I do understand how frustrating it is, because it is really difficult being having to maintain that distance, particularly in social areas. I know how frustrated people were when our communal kind of canteen areas were social distancing, because you just couldn't have a conversation, really, could you? So I think that the best option for this colleague is to get in touch with their infection control nurse and or the safer workplaces colleague that's around that, just to understand why that would be the case. I can't think of a rational explanation in my mind, but for clarity, across all community hospitals, the kind of extant position is social distancing ceased at the same time as it ceased across Grampian.
Okay, thanks, Caroline. The next question is again anonymous. The colleague asks what is being done to maintain and improve the NHS Grampian intranet. The colleague emphasises the importance of up-to-date information, but has highlighted a number of examples that are out of date, lengthy periods since pages were updated, stretching back years in some cases. He actually recommends that services and departments perhaps have a nominated webmaster to review their own sites regularly, removing out-of-date guidance, and asks if that's something you would be supportive of. I don't know if it's worth me coming in as a member of corporate comms on that one.
Yep.
Before we start. I guess what I would say on that is that the current system is actually very similar to the model the colleague has outlined. The way it's supposed to work is that departments are in charge of their own pages and the maintenance of those. Corporate comms looks after the corporate sections of the intranet. However, I know there's been a problem for a long time with people moving on, not having the training, and then other staff, not having the training to do the updating and maintenance of the website. And I believe it was also, the training was paused during COVID, which is further enhance the problems that we're facing. So I think to say, I know I checked when I saw the question had come in, I know that the webmaster training is coming back. It should be weeks, if not days, before that's reintroduced, which will help a little bit. But I think there's a general acknowledgement from everybody involved in the intranet that perhaps it's served its time and that we need to look at a refresh of that. I know eHealth are looking at a pilot scheme that might help do that, but it's still the early stages, and it's probably not my place to go into details on that, but I think it sounds promising at this point, and hopefully later in the year, I think there should be more details shared about that. I don't know if there's anything you want to comment on about that, Caroline.
I'm just glad that people are now submitting questions for you to answer instead of me. I think that's exactly the way we need to go. The only thing I'm going to add is I think we've got a new opportunity with the plan for the future and the importance that we are placing on engagement and communication. Now, it's always been important, but somehow we've just not managed to land it. So the internet and the intranet, if you like, are our front face. So I know how frustrated I get when I go on to an internet page and it's just not fit for purpose, and it kind of gives you a sense of confidence or not in the organisation that you're engaging with through that format. So I think that this has just underlined and re-prompted me to just make sure that in the first year's delivery plan, so this year's delivery plan of the plan for the future, we are absolutely understanding what it will take to have a really kind of contemporary, up-to-date intranet page.
Okay, the next question, again, anonymous, from one of the car parking team at ARI. So they have said that they feel that the role the reception staff played at the main concourse in ARI was vital, and they've asked if that's something that we could look at reintroducing. They feel that was a great place for patients to go and staff to go to as a first point of contact, and it worked really well. Is there anything you're aware of about that role?
No, although I am absolutely aware of how valuable colleagues were that signposted people, and I presume that has changed as we kind of put additional people in to support and guide people during COVID. So I don't have an answer to that, not going to waffle on, but I will speak to the team and understand who line managed those individuals, who they were, and what the plan is around that. And we'll just have to come back in the brief, Mike. I don't know the answer to that. That's a good suggestion.
Okay, thank you. Yeah. And they were certainly always the most friendly, smiley faces you saw when you walked into the hospital. I always wondered how they managed to keep that up, but they did. So, the next one is an anonymous question. They ask if NHS Scotland is one organisation, why is it that staff can't transfer to another health board directly? I'm not sure if that's probably a slight misconception that NHS Scotland is one organisation or not. But do you want to comment on whether staff should be able to transfer?
Yeah. So I think it is a slight misunderstanding, but an entirely reasonable misunderstanding, because we talk about NHS Scotland all the time. So NHS Scotland is an umbrella term, that there isn't an NHS Scotland as such. It's much more of a kind of agreement that we work across Scotland as an NHS, but we are separate organisations, although all governed under the same political system. So when we can do something once across Scotland, then we try to do that. But it's pretty technically difficult. We don't make it easy for ourselves. So if I had an HR colleague on the phone, on the call with me just now, or indeed a member of our staff side teams, then they would describe to me very eloquently why we have the processes that we have to ensure fairness and parity of everybody getting access to jobs that are advertised, etc. Do I think that there are other ways to do that? I hope that there are, because to be blunt, Mike, moving across territorial board boundaries is seems to be over here. We can't even, if somebody wants to go from one ward to another, we can't even do that without having a really technical process around it. Now, I'm not diminishing the importance of why we have the policies that we have. However, I have certainly been part of several conversations recently that have said, really, are we making it easy for people to be flexible and to move across different jobs? And if I'm really honest, I don't think we are. So I think there's work to be done. Again, around how we, back to the first question earlier around recruitment, how do we make that as simple yet retain the principles and values of fairness and access that are really just, but the ability that's the rationale around our policies for recruitment, and although moving across boards can be done, it is certainly technically very difficult. If the individual has a specific issue that they want to explore, then again, get in touch with the HR hub around some advice on that.
Okay, thank you, Caroline. And that's 50 minutes, so I really do appreciate your time today. As I said at the start, you've agreed that we could do another one next week to address some of the outstanding questions